all cancers have multiple causes and multiple genetic modulations, so they're not all the same. The one key factor, though, is once men are either treated with drugs or chemotherapy, you usually go into a lull period there. But then when you go into this castrate-resistant stage, then it grows very rapidly, and then the risk of death goes up dramatically.
Welcome to Longevity by Design, a podcast designed to give individuals access to the leading scientific information in the field of longevity. The ability to add years to your life and life to your years needs no opinion. Join us as we ask science to take the wheel. In each episode, Dr. Gil Blander joins a co-host and an industry expert in the field of longevity, shining a light and getting the answers to the key question: how can we live a longer, healthier life?
Hello, I'm Dr. Gil Blander. Welcome to Longevity by Design, how to live a longer, better life. We are produced by InsideTracker, your science-based guide to optimize your body from the inside out. Our guest today is Dr. John Erdman, who will discuss how dietary changes reduce the risk of prostate cancer. Dr. Erdman received his PhD in food science from Rutgers University. He is an emerite professor of food science and human nutrition at the University of Illinois, Urbana. He has authored over 200 original research articles and over 350 publications. He is a fellow of the American Society for Nutrition, the Institute of Food Technologists, and the American Heart Association. He is a past president of the American Society for Nutrition Science. Dr. Erdman studies how dietary changes such as the consumption of tomato product reduce the risk of prostate cancer. His team used ultrasound techniques for the early detection of prostate cancer and tumor growth, as well as monitoring the development of non-alcoholic liver diseases. He also studies how lutein, another carotenoid pigment, impact brain development. Welcome, John.
Thank you, Gil.
Excellent. So it's a pleasure having you here. And I would love to hear from you, why have you decided to become a scientist?
Well, my parents gave my twin brother and I a chemistry kit as a kid. I think that started some interest in science. From there, our high school was large enough that we actually had a chemistry course and an advanced chemistry course, which I took. And that started me as a chem major. I went to Rutgers University. I was a chem major for like 3 years. But I was always kind of looking for more applied chemistry, so I ended up switching into food science. And I was very fortunate as an undergrad. I worked for a guy named Paul LaChance, who was a physiologist, biochemist, and he had been at NASA and actually was involved with developing the space foods for the space food program. So that got me rolling.
Excellent, excellent. That's a very interesting background. And I think that your point about your parents provide to you a chemistry kit is for our audience. As a parent, we have a lot of influence of what our kids are going to do and how will they behave. So it's including whether they would like to study chemistry or not, in your example, John, but it's also how would they react to nutrition, would they eat junk food or good food, and would they exercise or not. So just a great example of how behavior from parents is so influential of the life of a esteemed professor at the University of Illinois. A great example. Thank you so much for that. So how did you get interested in the science of nutrition and specifically the effect on prostate cancer?
So our lab has collaborated over the years with many different labs. And in this particular case, Dr. Steve Clinton, who received his MD and his PhD here at the University of Illinois, he went on to Dana-Farber Cancer Institute in Boston. And he contacted me one day because he knew that there was a publication coming out from the Health Professionals Follow-Up Study at Harvard showing a relationship of increased tomato consumption and a reduction in risk of prostate cancer. And we had been friends, and he said he recognized our lab was pretty good at doing animal models of cancer. So he said, well, let's get going, let's get a grant going, and it'll be the early stages of this. So that was 25, 30 years ago. Mm-hmm. Yeah. So that the collaboration continues. He's at the Ohio State University, and we've worked together since then on a number of animal models of prostate cancer.
Excellent. And again, we just interviewed a few minutes ago a duo of scientists that working together. I can see that there is another duo here, which is great. Partnership and collaboration is much better than working alone. So let's start from basic. And John, can you describe what is cancer and why maybe we have cancer?
So generally, cancer is the uncontrolled growth of cells. So usually there's a mutation, and that causes cells to turn over at a higher rate, and you sort of get a pocket of cancer cells. Now those may be what we call indolent. They sit there for a long time, or they progress. And in the case of prostate cancer, many men at an early age have these mutations. However, they sit there for decades.
Yeah.
And then they can progress.
Yeah. And do you know, or do these scientists know, why prostate cancer, the majority of prostate cancer actually are sitting there exactly as you said, but they are like maybe, I would say 10%, maybe you know different statistic, are becoming very aggressive. What is the reason for that?
So prostate cancer goes through different stages, and probably ought to mention, so the prostate is a gland that surrounds the urethra, so that drains urine out of the bladder. So many older men, and you see all the advertisements on TV, have urinary problems. So the prostate grows over time, and it shrinks down on this tube, the urethra. Sometimes it's just benign, so it's non-cancer. But other times it's because of cancer growth, uncontrolled cancer growth. And there's this delay of decades. So most men, say in their late 60s or so, probably have prostate cancer, but it's not growing very fast, or it hasn't become a problem. But in some men, and because there's mutations, there's different stimuli for the prostate cancers to grow. And usually, initially, it's androgens, so like testosterone. So male hormones, and those like feed the cells and it causes them to grow. The first line of therapy usually is an anti-androgen therapy so that the androgens don't stimulate the cells. But in some people, after that treatment or radiation treatment, the cells mutate some more and they're able to grow on their own without androgens. And we call that androgen deprivation cancer or castrate-resistant cancer. So that's in, as you say, only about 10% of the cases.
And what is the prevalence of prostate cancer in the US?
So about 1 in 8 men will be diagnosed with prostate cancer. So it's a very high prevalence. It's one of the most highly diagnosed cancers in the US and throughout the world, actually. But it's late stage. So at age 50, only 1 out of like 350 men will be diagnosed with cancer. But it goes up dramatically once you into your 60s.
Yeah. So why is it aging-related disease?
Well, it's age-related because it sits there in an indolent stage for so long, and then it eventually some trigger, one or more triggers, gets it to grow. So it's a cancer of older men, not younger men. If somebody's diagnosed with prostate cancer age 50 or so, it's very aggressive and it's a really bad news. But later on, if it's diagnosed early, we can do something about it.
Yeah. Okay. And so it sounds like from what you said that there are a different kind of prostate cancer, like the one that you diagnose at the age of 50 is more aggressive, the one that you, most likely, the one that you diagnosed later is a bit less aggressive. Can you, do we have a few different kind of prostate cancer, or all of them are the same, or?
No, cancers and all cancers have multiple causes
Yeah.
and multiple genetic modulations, so they're not all the same. The one key factor, though, is once men are either treated with drugs or chemotherapy, you usually go into a lull period there. But then when there's you go into this castrate-resistant stage, then it grows very rapidly, and then the risk of death goes up dramatically.
Okay. And what is the 5-year survival on average for prostate cancer?
So for early stages, stage 1 and stage 2, which is when the cancer cells are still within the prostate, 97% survival.
Wow.
But once there's metastasis, so this is when some of the cells leave the prostate, go into the blood, and they go to bone or liver, now you're down to 37% survival after 5 years. So catching early is very, very important.
Yeah, it's amazing that 97% for 5 years, if you catch it early, that's amazing. So that's show how important it's to diagnose it early. So what are the warning signs that our audience, the male audience, can identify in order to go and do some testing to see if they have prostate cancer?
So, as I mentioned, when the prostate grows, squeezes the urethra, so urination becomes a problem. So then, to certainly see the doctor, generally they would diagnose, first of all, they would do a digital exam, the prostate, they could see if there's bumps on the prostate. You could also monitor PSA, prostate-specific androgen. That goes up in time. So this particular protein is generated mostly by the prostate. And if you have cancer or benign growth, or if you have an infection, it goes up. So if PSA jumps several units, that's a sign that there may be cancer. So at that stage, you would go in and have a biopsy.
Okay. And I think that the PSA is a great point, and I think that it's a good point for our audience to start and having a PSA level early, because then how would you know that it jump if you don't have your baseline, and each person is different. So try to, if you agree with me, one of the recommendation from this discussion is every male should have at least one test of PSA early in life, and that will allow him to have the baseline and then see when the jump is going.
I would agree. In the age 50-ish or so, now there's some controversy over PSA, but in my mind, if it jumps, in many people, that's the problem, and creating a baseline is important. So I have an identical twin brother. First of all, my father died of prostate cancer, so
wow.
I have a lot of motivation in this.
You are invested in this disease.
And my twin brother actually had his prostate removed because his PSA jumped.
Yeah.
So I obviously monitor very carefully my PSA, and luckily I've been fine to this point.
And are you identical twins or not?
Identical twins.
Yeah. So it's most likely the environment in that case.
Environment or yes, maybe nutrition.
Yeah.
He's an engineer, so.
Yeah. But so that's good to know. And so you started to discuss it, but maybe let's try to double click on that. So how do you diagnose prostate cancer?
So generally the digital exam, PSA, and then the biopsy, where they go in and take usually 10 or 12 different samples. It's an ultrasound guided biopsy. they would take those cells where they think there's a potential cancer, do histology, and usually genetics as well. And that would confirm or not confirm whether it's cancer.
Okay. And you mentioned digital diagnosis. What is that? Can you elaborate on that?
Yeah, so the doctor would put his finger up the rectum,
Okay.
and you can feel the prostate through the rectal wall.
Yeah.
And they check for size, or, as I said, bumps there. The ultrasound also will give you a reading on how big the prostate is. Generally, it's about a walnut-sized gland, 50 grams or something like that. But then it grows over time.
Yeah.
As a Longevity by Design podcast listener, you understand the value of improving your health for today and for all the years ahead. And if you want to live your healthiest, longest life possible, you need to understand what's going on inside. At Inside Tracker, we take a personalized approach to healthspan optimization that eliminates guesswork from your wellness plan. Inside Tracker analyzes blood biomarker and DNA data, along with physiomarker data from fitness trackers like Oura Ring, to deliver personalized food, supplement, lifestyle, and exercise recommendations that allow you to take control and improve your health span. And for a limited time, Longevity by Design listeners can get 20% off at the Inside Tracker store. So if you're ready to receive a personal health analysis and data-driven wellness plan to optimize your body for the long haul, then it's time to start inside. Visit insidetracker.com/podcast to get started today. That's insidetracker.com/podcast to get started today.
So from my experience in the past, I got tested like that, but then the clinician stopped doing it. And also there is, as you said, there is a disagreement about PSA as well, because I assume that the sensitivity is not high enough and basically the false positive is higher. So I think that in this domain today, as much I understand from in the medical community, there is a lot of, it's haven't settled down to how often to do PSA, how often to do the rectal digital test, and it's something that maybe it's very important for our male audience to realize that that's something that you can influence your clinician and basically direct him that you want to do it, because as you said before, if it's early, it's 97% chance to survive 5 years. If it's later, it's only around 70%. So there is a lot of value to do it.
Correct, and moreover, I'd say 10-15 years ago, there was an over-operations. So as soon as PSA went up and they found a little bit of cancer, men would have their, or the recommendation would be for men to have their prostate removed, and they probably went overboard on too much surgery.
Yeah.
So now they backed off a little bit, and watchful waiting is something that's quite important. So you can be diagnosed with cancer by biopsy, and you could, with consultation with your physician, you can decide, maybe I should wait 6 months and see if things change, or go forward with some intervention.
Yeah, and in my other life before I started Inside Tracker, I worked in the company that we were trying to develop a diagnostic for prostate cancer, and I exactly looked at the papers that you are talking about. That was more than 15 years ago, but there was a study in the Scandinavia, I think, that they basically did basically just watch and wait, and compare it to other countries that went aggressive and removed the prostate, and actually the survival was the same in early stages. Mm-hmm. So exactly suggests what you are saying. When you diagnose with prostate cancer, that doesn't mean that you're going to die tomorrow. It's good to know, and then monitor it every 6 months or whatever with your clinician. And it might be that you will die from different disease and you still have the prostate cancer. So,
majority of men will die from something else.
Yeah. So again, don't take it to the extreme. And if you have prostate cancer, you don't need to remove it immediately. Discuss it with your clinician and be sure that what is your situation, And I discussed it in the introduction to you, John, about ultrasound technique and early detection of prostate cancer. I think that you discussed it a bit, but I know that you and your lab are working on that. So can you elaborate on that?
Yes, so for the clinician, it's very valuable to have ultrasound at the same time as the needles are being put into the prostate. It shows where the potential cancers or tumors might be. For experimentally with models, I've also collaborated with Professor Bill O'Brien, who's in computer electrical engineering on campus here. And he and his lab developed techniques to monitor growth of tumors in animals. So we use mice and rats, and we're able to, in some of our, say, transgenic models of mice, where all the mice will eventually get a prostate tumor. We can do interventions with food or food components and see if we can slow that down by monitoring over time the growth of the prostate in that animal. So it's the same animal, we just sedate them, and we monitor growth over time. So it's really a great tool to use.
So you think that in the future maybe we can use it on human and basically monitor the size of the prostate?
Yes, I think it's already used, and of course you mentioned fatty liver.
Yeah.
Dr. O'Brien and his team also, and we've worked with people at University of California, San Diego,
Yeah.
to monitor fatty liver using ultrasound too, to get the exact percent of fat in the liver. So it's a very good tool.
Yeah, that sounds like. And now I would like to switch gear and discuss a bit about lifestyle. And so what is the effect of your lifestyle on the prevalence of having a prostate cancer?
Well, I think it's rather significant, particularly nutrition. So things like smoking affect all cancers. Right? Being overweight affects cancer growth. So physical activity. So the things that we recommend all individuals do to lower risk of heart disease apply to cancer as well. So increasing fruits and vegetables, reducing red meat. These are things that are all correlated pretty highly significantly with reduced risk of prostate cancer.
Yeah. So let's focus on nutrition. And you mentioned fruit and vegetable more and red meat less. Is there something specific about nutrition that we can do, or it's more general about more fruit and vegetable and less red meat?
Well, one of the risk factors for prostate cancer is inflammation. Mm-hmm. So we know that there's a lot of components of fruits and vegetables that would reduce the risk of inflammation. So getting more of your vitamins, and there's a lot of small molecules within foods that are not specifically vitamins that also reduce inflammation. So that's one approach. Plus we think some of the metabolic products of components of foods affect gene expression that impact cancer risk.
Okay. And I know that specifically you found some data that tomato products are good in prevention of prostate cancer, and also maybe in patients that are diagnosed with prostate cancer. Can you elaborate on that? Why tomato?
Sure. So it started again with 25 years ago with epidemiological observations. And we have now done work with several different kinds of cancers. So transplantable tumors, we've worked with transgenic tumors in rats and mice. And in all cases we're showing, so we'll take whole tomato, cooked tomato, freeze dry it, put it in animal diets, and then look for cancer progression or tumor growth. And in several different models, we always see an effect of lowering the rate of cancer growth. And this is key in men. As I mentioned before, many men have early stages of prostate cancer, but it's slowing the rate, delaying the time in which a tumor will grow.
Yeah.
Yeah. So we feel fairly strongly that tomato is quite important. We've also looked at broccoli, which slowed it, and soy germ, and we've also looked at them together, and there seems to be some synergy.
Interesting. So basically what you're saying that soy germ, tomato and broccoli are a food that if you consume more, you delay the progression of prostate cancer. Is it only in mice or you see it also in human?
Well, doing human studies is practically impossible.
Yeah.
Because you'd have to take 100,000 men or for 10 years or something. So we don't have the clinical, chronic intake studies in humans. There's some very small trials where, say, men are scheduled to have their prostate removed, and they'll give tomato or lycopene, which is the red pigment in tomato, for 3 weeks or 4 weeks, and look at genes and things. But that's not really applicable to slowing down the rate of cancer.
So we don't know yet if it's applicable for human. We know that it's very strong in mice, but we don't know yet.
Well, the epidemiology supports it. The logic supports it.
Okay.
And I think the main message, though, is getting tomato products in early.
Yeah.
Our own studies where we looked at castration-resistant cancer fed in animals, and we feed the animals after the tumor is already grown and is castration-resistant, we see no effect of tomato powder.
Okay. And what is the ingredient, the specific ingredient in tomato that make the effect?
So the main one that everybody looks to is lycopene. And lycopene, again, a carotenoid, red pigment tomatoes. It's also in watermelon and red guava and pink grapefruit, etc. But about 80% of our consumption of lycopene in North America is from tomato products.
Okay.
It certainly is an antioxidant, but in our hands, again, using experimental models, some of the metabolites of lycopene appear to be very effective in slowing growth of tumors.
And do you have a molecular mechanism? Why, or we don't know?
So lycopene is, in the plant kingdom, is a precursor to beta-carotene. Beta-carotene forms vitamin A.
Yeah.
Beta-carotene and vitamin A then forms retinoic acid. Retinoic acid is involved with hundreds of genes, so it's involved with retinoic acid receptors, and that directly affects gene expression. So back to lycopene, the products of lycopene look very much like retinoic acid, and therefore some of those products may affect gene expression, and that's, I think, the mechanism we're primarily looking at.
And I assume that if it's work for positively affect prostate cancer, it should affect other cancers as well, correct? Or it's not
So
specific?
Well, certainly epidemiologicals and some experimental work with breast cancer as well and others. To my knowledge, there's no evidence that it would have a negative effect on cancer.
Yeah. Okay. And you mentioned soy germ, and soy, at least from what I know, sometimes it's considered healthy and sometimes it's considered unhealthy. So what are the health effects of soy, and why soy is also might decrease the prostate cancer?
Yeah. So soy is pretty high in protein, and it's the most complete protein of all the plant sources. It also causes, it has isoflavones,
Yeah.
so genistein and datesine, etc. And those, particularly datesine, has some estrogenic, anti-estrogenic activity. So for some time there was concern, should women, with breast cancer consume soy or not? And some animal studies suggested that soy might increase cancer growth in women, but actually the large epidemiological prospective trials suggest, if anything, soy reduces risk. So it looks like datesine binds particularly to estrogen receptor beta, which reduces risk of cancer. So even with women who have had breast cancer, it looks like soy is fine to consume.
Okay, that's good to know, because I hear a lot of worries or excitement about the
Correct.
soy. So it sounds like nobody should be worried about it, and it's also a great source of protein, which most of us are not consuming enough. So definitely, I agree with you. So what are the future direction and goal of your work?
Right now, another collaboration. So Professor Jason Ridlin, who's in Animal Science Department here, he's a microbiologist primarily. And we've got involved, I'd say, over the last 6-7 years in some really fascinating work. So years ago, urine was considered to be sterile. But now, and a lot of it's his work, has shown that there are a number of bacteria that are in the urine. And together, our lab, his lab, other labs on campus, people at Johns Hopkins and also Michigan have shown that some of the microbes that are in the urine produce androgens from like cortisol or sometimes from even drug treatment. So the future direction is in men who have androgens reduced by either castration or by drugs. Will these organisms produce enough androgens to keep the cancers growing? That's the question. It's a very interesting hypothesis at this point, and we've got data from animals and humans, and there's some publications going in as we speak.
Interesting, very interesting. Thank you for that. And what potential intervention in the coming years do you think have the most promising for improving people's health span and maybe lifespan?
So in the prostate arena, it's early intervention. It really is. There's no data at all to suggest that once somebody's diagnosed with cancer, that something like tomato is going to reduce the prostate cancer. It's getting people in their 20s and 30s to eat correctly, maintain their weight, and get their exercise. It sounds very simple, but
it's not easy,
not easy.
Yeah, and it's very similar if you look at the cardiovascular diseases, it's the same. It's not like your LDL cholesterol or ApoB shoot to the roof at the age of 55 or 60. It's a process, and you're starting to block the arteries. The same is here. It's a process. Cancer is a process of decades, and if you are taking care of your body in a good way, you have a better chance not to absorb or develop those diseases. Again, genetic is also important, so there is no guarantee, but you can do the best that you can do to maintain your body.
Yeah, I fully agree with that.
Yeah. So is there anything else, John, that you would like to add that we haven't discussed already?
Well, I think One of the challenges in our environment, in North America particularly, is there's so much food around, and portion size is so large. And I know it's difficult and it's a challenge, but people should really try to maintain a reasonable intake of food, try to keep their weight, within some bounds, and get some exercise. And it's, again, simple, but people think they're invincible when they're in their 20s and 30s, right? Everything's fine, and then they hit their 50s. So early's best.
Yeah. Okay, good. And you might discuss it, but I'll ask it again. What is your top tip for health span and longevity?
It's maintaining weight and getting exercise. Just like we heard, when we were in grade school.
Yeah.
I think, but hard to do, but we should do it.
Excellent. Thank you so much. So I think that we are coming up on our time. Thank you so much, Dr. Erdman. We look forward to exploring the research in the field of longevity each month with you and a leading scientist. For more information, please go to instatracker.com/podcast. Again, thank you so much. It was a pleasure.
Very much.
And it was great to be here at Illinois and meet with you in person yesterday in the symposium, and today live and discussing your exciting research. Thank you so much.
Thank you, Gil.
Thanks for listening to Longevity by Design. Please subscribe to this podcast on Apple, Spotify, or YouTube. Longevity by Design is powered by Inside Tracker, a personalized health optimization platform that helps people improve their lives by improving their bodies from the inside out using personalized, science-backed recommendations for nutrition, supplements, and lifestyle changes. To learn more, visit insidetracker.com/podcast.